Drugs. What to know? It's not hard to find drugs, and sometimes it may seem like everyone's doing them, or wanting you to do them. But as with anything that seems too good to be true, there are downsides and dangers to taking drugs. How drugs work. Drugs are chemicals or substances that change the way our bodies work. Some are medicines that help people when doctors prescribe them. Many have no medical use or benefits. When taken, usually by swallowing, inhaling, or injecting, abused drugs find their way into the bloodstream. From there, they move to the brain and other parts of the body. In the brain, drugs may intensify or dull the senses, change how alert or sleepy people feel, and sometimes decrease physical pain. Because of the way these drugs work on the brain, they affect the ability to make healthy choices and decisions. Even drinking makes people more likely to get involved in dangerous situations, like driving under the influence or having unprotected sex. Although substances can feel good at first, they can do a lot of harm to the body and brain. Drinking alcohol, smoking or using tobacco, taking illegal drugs, even sniffing glue all damage the human body. Commonly abused drugs include alcohol, amphetamines, bath salts, cocaine and crack, cough and cold medicines, DXM, depressants, GHB, heroin, inhalants, ketamine, LSD, Mdma Ecstasy, marijuana, methamphetamine, meth, mushrooms, PCP, prescription pain relievers, opioids, Rohypnol, salvia. Getting help. If you think you, or a friend, may be addicted to drugs, talk to a parent, your doctor, school counselor, or nurse. They can help you get the help you need. Several kinds of treatment are available for drug addiction. The two main types are behavioral, helping a person change behaviors, and pharmacological, treating a person by using medicine. Experts in drug treatment teach people how to live without drugs, dealing with cravings, avoiding situations that could lead to drug use, and preventing and handling relapses. It can be hard to overcome drug addiction without professional help and treatment. It takes time, and isn't something that can be done alone. Everyone needs support. Experts who help people with addictions are trained to help, not judge. To find a drug treatment center in your area, search online, check out the SAWSA treatment locator, or ask a doctor or counselor for advice. Alcohol. Getting the facts. Just about everyone knows that the legal drinking age throughout the United States is 21. But according to the National Center on Addiction and Substance Abuse, almost 80% of high school students have tried alcohol. Deciding whether to drink is a personal decision that we each eventually have to make. This article provides some information on alcohol, including how it affects your body, so you can make an educated choice. What is alcohol? Alcohol is created when grains, fruits, or vegetables are fermented. Fermentation is a process that uses yeast or bacteria to change the sugars in the food into alcohol. Fermentation is used to produce many necessary items, everything from cheese to medications. Alcohol has different forms, and can be used as a cleaner, an antiseptic, or a sedative. So if alcohol is a natural product, why do teens need to be concerned about drinking it? When people drink alcohol, it's absorbed into their bloodstream. From there, it affects the central nervous system, the brain and spinal cord, which controls virtually all body functions. Because experts now know that the human brain is still developing during our teens, scientists are researching the effects drinking alcohol can have on the teen brain. Page 1. How does it affect the body? Alcohol is a depressant, which means it slows the function of the central nervous system. Alcohol actually blocks some of the messages trying to get to the brain. This alters a person's perceptions, emotions, movement, vision, and hearing. In very small amounts, alcohol can help a person feel more relaxed or less anxious. More alcohol causes greater changes in the brain, resulting in intoxication. People who have overused alcohol may stagger, lose their coordination, and slur their speech. They will probably be confused and disoriented. Depending on the person, intoxication can make someone very friendly and talkative or very aggressive and angry. Reaction times are slowed dramatically, which is why people are told not to drink and drive. People who are intoxicated may think they're moving properly when they're not. They may act totally out of character. When large amounts of alcohol are consumed in a short period of time, alcohol poisoning can result. Alcohol poisoning is exactly what it sounds like. The body has become poisoned by large amounts of alcohol. Violent vomiting is usually the first symptom of alcohol poisoning. Extreme sleepiness, unconsciousness, difficulty breathing, dangerously low blood sugar, seizures, and even death may result. Page 2. Why do teens drink? Experimentation with alcohol during the teen years is common. Some reasons that teens use alcohol and other drugs are: curiosity, to feel good, reduce stress, and relax, to fit in, to feel older. From a very young age, kids see advertising messages showing beautiful people enjoying life and alcohol. And because many parents and other adults use alcohol socially, having beer or wine with dinner, for example, alcohol seems harmless to many teens. Why shouldn't I drink? Although it's illegal to buy alcohol in the United States until the age of 21, most teens can get access to it. It's therefore up to you to make a decision about drinking. In addition to the possibility of becoming addicted, there are some downsides to drinking. The punishment is severe. Teens who drink put themselves at risk for obvious problems with the law. It's illegal, you can get arrested. Teens who drink are also more likely to get into fights and commit crimes than those who don't. People who drink regularly also often have problems with school. Drinking can damage a student's ability to study well and get decent grades, as well as affect sports performance, the coordination thing. You can look really stupid. The impression is that drinking is cool, but the nervous system changes that come from drinking alcohol can make people do stupid or embarrassing things, like throwing up or peeing on themselves. Drinking also gives people bad breath, and no one enjoys a hangover. Alcohol puts your health at risk. Teens who drink are more likely to be sexually active and to have unsafe, unprotected sex. Resulting pregnancies and sexually transmitted diseases can change, or even end, lives. The risk of injuring yourself, maybe even fatally, is higher when you're under the influence, too. 1/2 of all drowning deaths among teen guys are related to alcohol use. Use of alcohol greatly increases the chance that a teen will be involved in a car crash, homicide, or suicide. Teen drinkers are more likely to get fat or have health problems, too. One study by the University of Washington found that people who regularly had 5 or more drinks in a row starting at age 13 were much more likely to be overweight or have high blood pressure by age 24 than their non-drinking peers. People who continue drinking heavily well into adulthood risk damaging their organs, such as the liver, heart, and brain. Page 3. How can I avoid drinking? If all your friends drink, and you don't want to, it can be hard to say no, thanks. No one wants to risk feeling rejected or left out. Different strategies for turning down alcohol work for different people. Some people find it helps to say no without giving an explanation, others think offering their reasons works better. I'm not into drinking, I have a game tomorrow, or my uncle died from drinking, for example. If saying no to alcohol makes you feel uncomfortable in front of people you know, Blame your parents or another adult for your refusal. Saying, "My parents are coming to pick me up soon, I already got in major trouble for drinking once, I can't do it again, or my coach would kill me," can make saying no a bit easier for some. If you're going to a party, and you know there will be alcohol, plan your strategy in advance. You and a friend can develop a signal for when it's time to leave, for example. You can also make sure that you have plans to do something besides just hanging out in someone's basement drinking beer all night. Plan a trip to the movies, the mall, a concert, or a sports event. You might also organize your friends into a volleyball, bowling, or softball team, any activity that gets you moving. Girls or guys who have strong self-esteem are less likely to become problem drinkers than people with low self-esteem. Where can I get help? If you think you have a drinking problem, get help as soon as possible. The best approach is to talk to an adult you trust. If you can't approach your parents, talk to your doctor, school counselor, clergy member, aunt, or uncle. It can be hard for some people to talk to adults about these issues, but a supportive person in a position to help can refer students to a drug and alcohol counselor for evaluation and treatment. In some states, this treatment is completely confidential. After assessing a teen's problem, a counselor may recommend a brief stay in rehab or outpatient treatment. These treatment centers help a person gradually overcome the physical and psychological dependence on alcohol. Page 4. What if I'm concerned about someone else's drinking? Sometimes people live in homes where a parent or other family member drinks too much. This may make you angry, scared, and depressed. Many people can't control their drinking without help. This doesn't mean that they love or care about you any less. Alcoholism is an illness that needs to be treated just like other illnesses. People with drinking problems can't stop drinking until they're ready to admit they have a problem and get help. This can leave family members and loved ones feeling helpless. The good news is there are many places to turn for help. A supportive adult, such as your guidance counselor, or a relative or older sibling will understand what you're going through. Also, professional organizations like Alateen can help. If you have a friend whose drinking concerns you, make sure he or she stays safe. Don't let your friend drink and drive, for example. If you can, try to keep friends who have been drinking from doing anything dangerous, such as trying to walk home at night alone or starting a fight. And protect yourself, too. Don't get in a car with someone who's been drinking, even if that person is your ride home. Ask a sober adult to drive you instead or call a cab. Everyone makes decisions about whether to drink, and how much, even adults. It's possible to enjoy a party or other event just as much, if not more so, when you don't drink. And with your central nervous system working as it's supposed to, you'll remember more about the great time you had. Amphetamines. What it is. Amphetamines are very addictive stimulants. They speed up functions in the brain and body. They come in pills or tablets. Prescription diet pills also fall into this category of drugs. Sometimes called speed uppers, dexes, bennies, hearts, truck drivers. How it's used. Amphetamines are swallowed, smoked, snorted, or injected. What it does. No matter how a person takes amphetamines, these drugs hit with a fast high, making the user feel powerful, alert, and energized. These uppers pump up heart rate, breathing, and blood pressure, and can also cause sweating, shaking, headaches, sleeplessness, and blurred vision. Long or lasting use may cause hallucinations and intense paranoia. Even after users stop taking amphetamines, they may still have problems such as aggression, anxiety, and strong cravings for the drugs. Bath salts. What it is. The name bath salts sounds innocent, but these are powerful and dangerous stimulant drugs. sometimes called Bloom, Cloud9, Flakka, Scarface, Vanilla Sky, and White Lightning. How it's used. Bath salts are sold as a white or off-white powder, mostly in small plastic or foil packages. The drugs are usually snorted, sniffed up a nostril. They also can be swallowed, smoked, or mixed with a liquid and injected with a syringe. What it does. Bath salts contain man-made chemicals that increase brain and central nervous system activity in much the same way as drugs like amphetamines or Mdma Ecstasy. Bath salts can cause users to have an out-of-body experience, elated mood, or feel delirious. These effects can last up to 3 to 4 hours. Other short-term effects include agitation and irritability, insomnia, dizziness, panic attacks, depression, suicidal thoughts, paranoia, delusions and hallucinations, distorted sense of reality, decreased ability to think clearly, mood disturbances and psychosis. Physical effects of bath salts include decreased muscle and body control, increased blood pressure and body temperature, chest pains, irregular heartbeat, nosebleeds, feeling sick and throwing up, seizures, stroke, heart attack, brain swelling. Users can also develop what is called excited delirium. When this happens, people get dehydrated, their muscle tissue breaks down, and they can go into kidney failure and die. Long-term abuse of bath salts may cause people to have hallucinations, hear voices, feel paranoid, and develop a psychosis that resembles schizophrenia. People who use bath salts easily can get addicted to them. They may feel driven to do whatever they can to keep getting high, including taking risks. Bath salts can cause heart problems and seizures. Taking too much of the drug at one time can lead to an overdose. All these things can be deadly, even if someone only tries the drug once. Bath salts have caused a number of deaths, and been blamed for a handful of suicides and murders. 2 of the chemicals in bath salts, morphedrone and MDPV, are Schedule I class drugs. That means they have a high potential for abuse, and no accepted medical use. People who are caught with bath salts can face fines and jail time. Cocaine. What it is. Cocaine is a white powder that comes from the dried leaves of the coca plant, which is found in South America. Crack cocaine is a form of the drug that gives a very quick, intense high. Crack is made by cooking cocaine powder with baking soda, then breaking it into small pieces called rocks. It got its name because it crackles when it is heated and smoked. Crack cocaine looks like white or tan pellets, sort of like gerbil or dry cat food. Both cocaine and crack are very addictive, and very, very dangerous. Sometimes called coke, rock, snow, blow, white, toot, nose candy, base, flake, powder, bossa, smack. How it's used. Cocaine is inhaled or snorted through the nose or injected into a vein. Crack is smoked in a pipe. What it does. Cocaine is a stimulant, which means that it produces a fast, intense feeling of power and energy. Then it wears off. Crack wears off very quickly, and the user feels depressed and nervous and craves more of the drug to feel good again. Cocaine is so addictive that someone can get hooked after trying it just once. Snorting cocaine can damage the septum between the nostrils, causing a hole in the middle of the nose. Cocaine makes the heart beat faster and blood pressure and body temperature go up. It also can make the heart beat abnormally. Cocaine is so dangerous that using it just once can cause a heart attack. cough and cold medicine abuse. What it is. Dextromethorphan, DXM, is an ingredient in many over-the-counter, OTC, cough and cold medicines. Sometimes called candy, drink, robo, CCC, Dex, DM, Drex, Red Devils, Royot, Skittles, Tussin, Velvet, and vitamin D. How it's used. Medicines that have DXM in them come as syrups, capsules, pills, or throat lozenges. But some people extract DXM from cough syrup and make it into a powder or capsule of pure DXM. Dextromethorphan containing products, tablets, capsules, gel caps, lozenges, and syrups, are labeled DM, cough suppressant, or TUS, or contain TUS in a title. What it does. When people take too much DXM, they might have hallucinations and out-of-body sensations. DXM also depresses brain function, particularly the parts of the brain that control breathing and heart function. Taking a lot of DXM causes hallucinations and out-of-body sensations similar to the ones caused by drugs like ketamine and PCP. These effects can last as long as 6 hours. DXM also can make users have trouble controlling their limbs and cause blurred vision, slurred speech, dizziness, and impaired judgment. Other short-term effects include paranoia and confusion, excessive sweating, nausea and vomiting. Large quantities of cough syrup almost always cause people to throw up, belly pain, irregular heartbeat and high blood pressure, restlessness, dry, itchy skin and facial redness. DXM might seem safe since it's sold over the counter, but large quantities can cause dangerous side effects, including loss of consciousness, seizures, brain damage, and death. One particularly dangerous side effect of DXM is hyperthermia, extremely high fever. This is a big problem in hot environments or when DXM users physically exert themselves, like while dancing at a club. High body temperatures can quickly lead to brain damage or a coma. It's possible to overdose on too much DXM, especially if it's in pure powder form. Someone who overdoses may have brain damage or seizures, and might even die. People using cold medicines to get high may not realize they're taking high doses of many drugs, not just DXM. Mixing DXM with other drugs or alcohol increases the likelihood of life-threatening conditions. For instance, combining it with drugs like MDMA increases the risk of hyperthermia, and can lead to brain damage, seizures, a coma, and death. Depressants. What they are. Tranquilizers and other depressants calm nerves and relax muscles. They are bright-colored capsules or tablets that are legally available through a doctor for medical reasons, but can be illegally abused. Sometimes called candy, downers, goofballs, barbs, yellow jackets, lubes, red birds, sleeping pills, tuas, tranks, zombie pills. How they're used. Depressants are swallowed. What they do. When used as prescribed by a doctor, depressants can calm nerves and relax muscles. Larger or improperly used doses of depressant drugs can cause confusion, lack of coordination, low blood pressure, and slowed heart rate and breathing. Someone who takes them may have slurred speech and an inability to concentrate, and may fall asleep at work or school. Depressants are addictive, and withdrawal symptoms include anxiety, sleeplessness, and seizures. Depressant drugs are very dangerous if taken with alcohol and some other drugs. Very large doses of depressants can stop breathing and cause death. GHB. What it is. GHB, gamma-hydroxybutyrate, is a depressant. It's usually available as a clear liquid. It is known as a designer drug because it is made, usually in home basement labs, for the purposes of getting high. Like ecstasy, GHB is popular with club goers and those who go to rave parties, including teens and young adults. When mixed with alcohol, it has a depressant effect that can cause someone to black out. This is why GHB is often called the date rape drunk. Sometimes called liquid ecstasy, Georgia Homeboy, cups. How it's used. Swallowed, in liquid or powder form, which is mixed with water, or as tablets. What it does. GHB causes both a euphoric high, intense rush of happy feelings, and hallucinations. GHB has caused many young people to need emergency medical care. Because the liquid is odorless and colorless, it's sometimes slipped unknowingly into a person's drink. Side effects of GHB use include drowsiness, dizziness, nausea, vomiting, and vision changes. People who take GHB may become unconscious, pass out, stop breathing, and go into a coma. GHB use can kill. Because both GHB and alcohol are depressants, mixing the two is very dangerous and can be deadly, even if someone has only taken low doses of the drug. Because of its serious effects, GHB has led to emergency medical care for many young people, and has killed more users than the drug Heroin. What it is. Heroin belongs to a group of pain-relieving drugs called narcotics. The drug comes from the opium poppy, a flower that grows in Asia, Mexico, and South America. Pure heroin has the consistency of white powder. Some heroin is also dark brown, while black tar heroin is either sticky or hard and looks like roofing tar. Although some narcotics like codeine and morphine are legal if prescribed for pain relief, heroin is an illegal narcotic because it has dangerous side effects, and is very addictive. Sometimes called horse, smack, big H, black tar, caballo, Spanish, 8-ball, heroin mixed with crack cocaine, junk, TNT. How it's used. Heroin is usually injected or smoked. Purer forms of heroin are inhaled. What it does. Heroin provides a burst or rush of good feelings, and users feel high and relaxed. This may be followed by drowsiness and nausea. Many people who are addicted to heroin inject the drug into a vein with needles, and may inject the drug several times a day. Over time, the needle marks, or tracks, can become permanent scars. Often, heroin addicts will share needles, which can lead to infection with dangerous germs like hepatitis B, hepatitis C, or HIV, the virus that causes AIDS. Heroin is a very addictive drug, and many people find it extremely difficult to stop using it, even after using it for just the first or second time. Heroin users constantly crave their next dose. If heroin addicts suddenly try to stop using the drug or are unable to get another dose, they often develop withdrawal symptoms, like feelings of panic, sleeplessness, bad chills and sweats, muscle pain, stomach cramps, nausea, vomiting, and diarrhea. Taking an overdose of heroin can cause a person to stop breathing and die. This is especially true if the heroin is mixed with a synthetic opioid like fentanyl. Many dealers now lace heroin with fentanyl, a painkiller that is much stronger than heroin, and can cause an overdose more quickly. Inhalants. What they are. Inhalants are things that are breathed in to give the user an immediate rush, or high. They include glues, paint thinners, dry cleaning fluids, gasoline, felt tip marker fluid, hairspray, deodorants, spray paint, and whipped cream dispensers, whippets. Sometimes called whippets, poppers, snappers, rush, bolt, bullet. How they're used. These are inhaled directly from the container, called sniffing or snorting, from a plastic bag, called bagging, or by holding an inhalant-soaked rag in the mouth, called huffing. What they do. Inhalants produce a quick feeling of being drunk, followed by sleepiness, staggering, dizziness, and confusion. Long-time users get headaches, nosebleeds, and sometimes lose their sense of smell. Inhalants decrease oxygen to the brain, and can cause brain damage. Using an inhalant just one time can lead to life-threatening health problems, and even cause death. Ketamine. What it is. Ketamine hydrochloride is a quick-acting anesthetic that is legally used in both humans, as a sedative for minor surgery, and animals, as a tranquilizer. At high doses, it causes intoxication and hallucinations similar to LSD. Sometimes called K, Special K, Vitamin K, Bump, Cat Valium, Kit Kat, Super Acid, Purple. How it's used. In different forms, ketamine can be snorted, swallowed, smoked, or injected. Users often use it along with other drugs such as ecstasy, called kitty flipping, or cocaine, or sprinkle it on marijuana blunts. What it does. People who use ketamine can become psychologically dependent on it to feel good, deal with life, or handle stress. Users may become delirious, hallucinate, and lose their sense of time and reality. The trip, or K-hole, that results from ketamine use lasts up to 2 hours. Users may become nauseated or vomit, and have problems with thinking or memory. At higher doses, ketamine causes movement problems, body numbness, and slowed breathing. Overdosing on ketamine can stop breathing and cause death. LSD. What it is. LSD, lysergic acid diethylamide, is a hallucinogenic drug. Hallucinogens change the way people sense the world around them. Sometimes called acid, sugar cubes, white lightning, dose, tripping, blotter. How it's used. LSD is odorless, colorless, and tasteless. It can be painted onto small squares of paper that people lick or swallow. What it does. LSD causes the senses of space, distance, and time to become altered. People say they hear colors or see sounds, and have strange feelings and strong emotions. Many users refer to an acid trip, when the effects don't let up and can last for up to 12 hours at a time. LSD also can cause bad trips, when users experience panic, confusion, sadness, and scary images. Bad reactions can happen with the first use, and a user may have flashbacks later, experiencing the feelings of a bad trip even after the drug wears off. Because LSD also affects judgment and behavior, users might find themselves in a dangerous situation. Physical changes include increased heart rate and blood pressure, muscle twitches and shaking, dilated pupils, sweating, sleeplessness, and loss of appetite. Mdma Ecstasy. What it is. Ecstasy, 3,4-methylene-dioxy-N-methamphetamine, or MDMA, is a drug that is illegally made. Ecstasy is a stimulant drug that can cause hallucinations. It is known as a designer drug because it was created for the purpose of making someone feel high. The drug is popular with teens and young adults who go to clubs, concerts, or rave parties. Users think the drug will make them feel good and keep them going for days without rest. But people who use ecstasy don't realize how dangerous this drug is. Ecstasy has become one of the most common illegal drugs sold on the streets. In the last few years, ecstasy has sent many people to emergency rooms because of its dangerous side effects. Sometimes called XDC, X, Adam, E, Roll, A, 007, Molly. How it's used. Ecstasy can be swallowed, pill or tablet, or snorted, powder. What it does. Ecstasy is both a hallucinogenic and a stimulant drug. It makes users experience a rush of good feelings, a high, and makes feelings much more intense, whether they're good or bad. The drug's effects usually last up to 6 hours. Ecstasy increases heart rate, and can cause dry mouth, clenched teeth, blurred vision, chills, sweating, or nausea. It can make some users feel anxious, confused, and paranoid, like someone is trying to hurt them or is plotting against them. Ecstasy may damage brain cells that are involved in thinking and memory. If a person takes ecstasy, his or her body can dangerously overheat during dancing or other physical activities, which can lead to muscle breakdown, kidney, liver, and heart damage, and even death. Ecstasy use can cause seizures, brain swelling, possible brain damage, and even death. Marijuana. What is marijuana? Marijuana is a shredded, green-brown mix of dried flowers, stems, and leaves from the plant Cannabis sativa. A stronger form of marijuana, called hashish, hash, looks like brown or black cakes or balls. The amount of THC, the active ingredient, in marijuana and marijuana products has increased greatly over the years. Marijuana is usually rolled and smoked like a cigarette, joints or doobies, or put in hollowed-out cigars, blunts, pipes, bowls, or water pipes, bongs. Recently, it has become increasingly popular for people to inhale marijuana or stronger marijuana extracts using a vaporizer, called vaping or dabbing. Some people mix it into food or brew it as a tea. There is also synthetic marijuana, man-made drugs that are chemically similar to THC, that can be dangerously strong. Names for these drugs include K2, spice, and herbal incense. They can be so potent that overdose deaths have happened. Short-term effects. The main active chemical in marijuana is THC, delta-9-tetrahydrocannabinol. When someone smokes marijuana, THC goes from the lungs into the bloodstream. From there, it ends up in the brain and other organs. THC connects with a receptor on nerve cells in the brain. The marijuana high results from THC's effects on the nerve cells that control sensory perception and pleasure. THC also connects with receptors on nerve cells in other parts of the brain that affect thinking, memory, coordination, and concentration. This can cause unwanted side effects, including trouble thinking and problem solving, problems with memory and learning, loss of coordination, distorted perception. These side effects are temporary, but they can make it dangerous to do things like drive while under the influence of marijuana. People also might notice other short-term side effects of using marijuana, such as an increased appetite, feeling lightheaded or drowsy, a decrease in inhibitions. Long-term effects. Research has found that people who use marijuana over a long period of time can have more lasting side effects. For example, changes in the brain. Marijuana can affect the parts of the brain that play a role in our ability to remember, multitask, and pay attention. Fertility issues. Animal studies suggest that using a lot of marijuana might be linked to decreased sperm count in men and delayed ovulation in women. Pregnant women who use marijuana might be more likely to have babies with developmental and behavioral problems. Respiratory problems. People who smoke marijuana a lot can develop problems with the respiratory system, like more mucus, a chronic cough, and bronchitis. Immune system problems. Using marijuana a lot might make it harder for the body to fight off infections. Emotional problems. People who use a lot of marijuana are more likely to say they notice signs of depression or anxiety. If someone has a condition like schizophrenia or bipolar disorder, marijuana can sometimes make symptoms worse. Other problems. Here are a few ways marijuana use could affect you. Criminal charges. Marijuana laws can be confusing. Some states are changing their laws to make it legal to have small amounts of marijuana in some situations, like when it's prescribed for medical use. Some have even made recreational use of marijuana by adults, over 21, legal. But there are conflicting federal laws against using, growing, or selling marijuana, and people caught with it could face charges, including jail time. Career problems. People charged under marijuana laws may end up with criminal records that hurts their plans for college or finding a job. Drug testing. These days, employers often test for drug use as part of the hiring process. Marijuana can show up on a drug test for several weeks after it was last used. So people who use marijuana may find they don't get a job they want. Some companies do routine drug tests on employees, so people who use marijuana can lose their jobs. Medical use of marijuana. The U.S. Food and Drug Administration, FDA, has approved pills containing THC or other cannabinoids, chemicals similar to THC, as a way to help relieve pain, nausea, muscle stiffness, or problems with movement. There's still a lot of discussion about the medical use of marijuana, though. THC and other cannabinoid pills are only available in some states, and require a doctor's prescription. At the moment, there's not enough research to say for sure if smoking marijuana is any more helpful than taking THC or other cannabinoids as a pill. Scientists are still studying this. What if I want to quit? People who use marijuana for a while can have withdrawal symptoms when they try to give it up. They may feel irritable, anxious, or depressed, have trouble sleeping, or not feel like eating. Marijuana withdrawal can be a bit like caffeine withdrawal. It's usually worse a day or two after someone stops using marijuana. After that, withdrawal symptoms gradually decrease. They're usually gone a week or two after the person no longer uses the drug. Marijuana can be addictive. About 1 in 10 people who use the drug regularly can develop a marijuana use disorder. These people can't stop using marijuana even though it's causing problems in their lives. This is much more likely to happen in people who start using marijuana before age 18. If you or someone you know wants to stop using marijuana but has trouble quitting, it can help to talk to a counselor. Studies suggest that a combination of individual counseling and group therapy sessions is the best approach for stopping marijuana use. Methamphetamine, meth. What it is. Methamphetamines are stimulants, a type of drug that lets people stay awake and do continuous activity with less need for sleep. These drugs are made as pills, powders, or chunky crystals called ice. Ice, nicknamed crystal meth, is a popular drug, especially with young adults, and for those who go to lots of dance clubs and parties. Sometimes called speed, uppers, meth, crystal meth, chalk, ice, glass, Christmas tree, crank, especially when injected. How it's used. Methamphetamines are swallowed, inhaled, smoked, or injected into a vein. What it does. Swallowed or snorted, also called bumping, meth give the user an intense high. Injections create a quick but strong intense high, called a rush or a flash. People who abuse methamphetamines feel high and full of energy. They think the drug will allow their bodies to keep going and going. But meth is very damaging to the body and brain, especially with repeated use. Side effects include rapid breathing, an irregular heart rate, and increased blood pressure. Users also complain of sweating, headaches, blurred vision, dry mouth, hot flashes, and dizziness. Because the drug often decreases or even eliminates appetite, it has been used as a dangerous dieting strategy for people trying to lose weight quickly. Meth mouth is another risk. This severe tooth decay and gum disease often causes teeth to break or fall out. Long-term use can bring on brain damage that causes problems with memory and body movements, and can cause mood swings and violent behavior. When used in larger doses, meth can cause dangerously high body temperature, confusion, convulsions, uncontrollable jerking body movements, and even death. Mushrooms. What it is. Some kinds of mushrooms contain psilocybin and psilocin, substances that can cause hallucinations. Used in large enough doses, these mushrooms have effects similar to the drug LSD. Sometimes called shrooms, magic mushrooms. How it's used. Hallucinogenic mushrooms might be either fresh or dried. People take them as drugs by eating them, mixing them with food to mask the bitter taste, or brewing them in a tea for drinking. What it does. The effects of mushrooms generally begin after about 30 to 45 minutes. They can last as long as 6 hours. Early effects typically include nausea and excessive yawning. After these initial effects, the trip begins. A trip might be mild, leaving a person feeling drowsy or relaxed. But higher doses or stronger mushrooms can bring on hallucinations, anxiety, paranoia, and nervousness. The person may have a distorted sense of time, place, and reality. Too large a dose can lead to a long-term mental health condition known as psychosis. The length and intensity of each mushroom trip can vary. It depends on how strong the mushrooms are, and how much someone took. How a trip turns out also depends on the user's mood, personality, and expectations. Some trips may be enjoyable, but others lead to terrifying thoughts of losing control, intense paranoia, panic attacks, and fears of death. With mushrooms, it's very hard to predict what sort of trip each user will have. There's also no way to end a bad trip until it has run its course, which could be hours later. The physical effects of mushrooms can include nausea and vomiting, increased heart rate, blood pressure, and temperature, muscle weakness, drowsiness, lack of coordination, dilated pupils. In very rare cases, if someone takes a huge amount of mushrooms, the side effects can be severe enough to cause death. Some mushroom users have flashbacks where they relive some part of a drug trip when they're no longer high. Flashbacks can come on without warning. They might happen a few days after taking mushrooms or months later. It's hard to know how strong mushrooms are. Buying mushrooms is also risky because some mushrooms are drugs, but others are extremely poisonous. A number of mushroom species can make people violently ill or even kill them. Hallucinogenic mushrooms can give people stomach cramps or make them throw up. They also give some users diarrhea. Because mushrooms alter a person's sense of reality and affect judgment, trying to drive while under the influence of mushrooms is likely to cause accidents. Mushrooms are an illegal drug listed as a Schedule I substance in the United States. This means they have a high potential for abuse and serve no legitimate medical purpose. Possession or use of hallucinogenic mushrooms is punishable by fines and jail time. PCP. What it is. PCP, or phencyclidine, is a dangerous drug that was originally developed as an anesthetic. Its use was discontinued in humans in 1965 because of the troubling side effects. It is now illegal in the United States. Sometimes called angel dust. How it's used. In its pure form, PCP is a white crystalline powder. It dissolves quickly in liquids but has a distinctive, bitter chemical taste. Most PCP sold in the United States comes as a white or colored powder or liquid and is added to leafy substances, such as oregano, mint, or marijuana, and smoked. PCP also can be sold in pill, tablet, or capsule form to be swallowed. In some cases, PCP users snort the drug or mix it with a liquid and inject it with a syringe. What it does. PCP affects the user's memory, ability to process emotion, and learning ability. At lower doses, the effects of PCP can be similar to alcohol intoxication. PCP can make users feel detached from their bodies and their surroundings. It can also distort a user's perceptions of sight, sound, and reality. The drug is known for giving users a false sense of strength, power, and invincibility. Higher doses of PCP can cause hallucinations and symptoms similar to the effects of mental illnesses like schizophrenia. These include anxiety, delusions, paranoia, trouble forming coherent thoughts, suicidal thoughts, and bizarre behavior. PCP users can get violent. Depending on the dose and way the PCP was taken, injected, smoked, or swallowed, the drug's effects can be felt in 2 to 5 minutes, and last anywhere from 6 to 24 hours. PCP can also cause these physical side effects: body numbness, dizziness, drooling, slurred or garbled speech, loss of muscle coordination and balance, profuse sweating, rapid, involuntary eye movements or a blank stare, nausea and vomiting. PCP is addictive. Long-term use can lead to mental and physical cravings for the drug, and compulsive behavior to get and take it. Because the drug is so addictive, users keep taking it even when they know the health problems PCP causes. PCP can have sedative effects. If it's mixed with other sedatives, such as alcohol or depressants, it can put a user in a coma and cause serious, life-threatening consequences. Some PCP users suffer frequent hallucination flashbacks and other mental disorders over a long period of time. PCP is an illegal drug listed as a Schedule II substance in the United States. Possession or use is punishable by fines and jail time. Prescription drug abuse. Taking prescription drugs in a way that hasn't been recommended by a doctor can be more dangerous than people think. In fact, it's drug abuse. And it's illegal, just like taking street drugs. Why do people abuse prescription drugs? Some people abuse prescription drugs because they think they will help them have more fun, lose weight, fit in, and even study more effectively. Prescription drugs can be easier to get than street drugs. Family members or friends may have them. But prescription drugs are also sometimes sold on the street like other illegal drugs. In 2017, 1 in 17 surveyed said they have taken a prescription drug without a doctor's prescription. But prescription drugs are only safe for the people who have prescriptions for them. That's because a doctor has examined these people and prescribed the right dose of medicine for their medical condition. The doctor has also told them exactly how they should take the medicine, including things to avoid while taking the drug. They also are aware of side effects and can watch patients closely for these. Which drugs are abused? The most commonly used prescription drugs fall into 3 classes. 1. Opioids. Examples: oxycodone, OxyContin, hydrocodone, Vicodin, and meperidine, Demerol. Medical uses. Opioids are used to treat pain or relieve coughs or diarrhea. How they work. Opioids attach to opioid receptors in the central nervous system, the brain and the spinal cord, preventing the brain from receiving pain messages. 2. Central nervous system, CNS, depressants. Examples: phenobarbital, luminal, diazepam, Valium, and alprazolam, Xanax. Medical uses. CNS depressants are used to treat anxiety, tension, panic attacks, and sleep disorders. How they work. CNS depressants slow down brain activity by increasing the activity of a neurotransmitter called GABA. The result is a drowsy or calming effect. 3. Stimulants. Examples: methylphenidate, Ritalin, and amphetamine or dextroamphetamine, Adderall. Medical uses. Stimulants can be used to treat narcolepsy and ADHD. How they work. Stimulants increase brain activity, resulting in greater alertness, attention, and energy. Page 2. What are the dangers of abusing medicines? The likelihood that someone will commit a crime, be a victim of a crime, or have an accident is higher when that person is abusing drugs, no matter whether those drugs are medicines or street drugs. Like all drug abuse, using prescription drugs for the wrong reasons has serious risks for a person's health. Opioid abuse can lead to vomiting, mood changes, decreased inability to think, cognitive function, and even decreased respiratory function, coma, or death. This risk is higher when prescription drugs like opioids are taken with other substances like alcohol, antihistamines, and CNS depressants. CNS depressant abuse is risky too. Abruptly stopping or reducing them too quickly can lead to seizures. Taking CNS depressants with other medicines, such as prescription painkillers, some over-the-counter cold and allergy medicines, or alcohol can slow a person's heartbeat and breathing, and even kill. Stimulant abuse, like with some ADHD drugs, may cause heart failure or seizures. These risks are increased when stimulants are mixed with other medicines, even OTC ones like cold medicines. Taking too much of a stimulant can lead to a dangerously high body temperature or an irregular heartbeat. High doses over a short period may make someone aggressive or paranoid. Stimulant abuse might not lead to physical dependence and withdrawal, but users might take the drugs so often that they become a hard habit to break. The dangers of prescription drug abuse can be made even worse if people take drugs in a way they weren't intended to be used. Ritalin may seem harmless because it's prescribed even for little kids with ADHD. But when a person takes it either unnecessarily or in a way it wasn't intended, such as snorting or injection, Ritalin toxicity can be serious. Probably the most common risk of prescription drug abuse is addiction. People who abuse medicines can become addicted as easily as if they were taking street drugs. That's one reason most doctors won't renew a prescription unless they see the patient. They want to examine the patient to make sure he or she isn't getting addicted. Tips for taking prescription medicine. If a doctor prescribes a pain medicine, stimulant, or CNS depressant, follow the directions exactly. Also be sure to keep all doctor's appointments. Your doctor will want you to visit often so he or she can see how well the medicine is working for you and adjust the dose or change the medication as needed. Make a note of the effects the drug has on your body and emotions, especially in the first few days as your body gets used to it. Tell your doctor about these. Keep any information your pharmacist gives you about any drugs or activities you should steer clear of while taking your prescription. Never increase or decrease the dose of your medicine without checking with your doctor's office first. Finally, never use someone else's prescription. And don't allow anyone to use yours. Not only are you putting others at risk, but you could suffer too. Pharmacists may be stopped from refilling a prescription if a medicine has been used up before it should be. And if you're found giving medicine to someone else, it's considered a crime, and you could find yourself in court. Taking prescription opioid pain medicines safely. Opioids are very good at controlling pain, but there are risks to taking these medicines. They can cause serious side effects and lead to dependence, addiction, and overdose. The misuse of these medicines has contributed to the crisis in America. Hundreds of people die from opioid overdoses every day, and millions are fighting addiction. If you've been prescribed a medicine that contains an opioid, follow this opioid safety checklist. Share this information with the parent or trusted caregiver who will be helping you take, store, and get rid of the medicine. Opioid safety checklist. Take the opioid medicine exactly as prescribed. Don't take more of the medicine than prescribed. Don't take the medicine more often than prescribed. Don't take any other medicines unless you check with your healthcare provider or pharmacist first. Do not drink alcohol while taking the opioid medicine. It can lead to serious medical problems, even death. Do not drive, ride a bike, or operate machinery while taking the medicine because the medicine can make you sleepy. Do not take opioid medicine if you are or may be pregnant. It can cause serious problems in a baby. Do not share your medicines with anyone. Have a parent or trusted caregiver. Store the opioids in a locked cabinet away from children, friends, and visitors. Keep track of how much medicine is in the container so you know if someone else is taking the medicine. Safely dispose of any leftover opioids as soon as you no longer need them. What opioid pain medicines are prescribed for kids and teens? Opioid pain medicines prescribed for children and teens include hydrocodone with acetaminophen liquid, Piquet registered trademark, and pills, Vicodin registered trademark and Lorton registered trademark. Oxycodone with acetaminophen liquid, Roxicet registered trademark, and pills, Percocet registered trademark. Hydromorphone liquid and pills, Dilaudid registered trademark. Morphine liquid and pills. Oxycodone liquid and pills. Others, your healthcare provider may prescribe an opioid pain medicine that is not on this list. What are the risks of opioid pain medicines? If you take an opioid pain medicine for a few days, you might notice side effects like sleepiness, constipation, itching, and stomach upset. When opioids are taken as directed, these side effects may be annoying, but are not dangerous. Taking opioids for longer brings other risks, including developing a tolerance, needing more opioid for the same pain relief, physical dependence, having symptoms of withdrawal when the opioid is stopped, addiction, when someone has very strong cravings, and will continue to take an opioid even when it causes problems with health, relationships, and money. Taking too much of an opioid or mixing it with other drugs and/or alcohol can lead to overdose and death. Could I become addicted to opioids? Most kids and teens who take opioids for a short time as instructed by a healthcare provider do not get addicted. For example, a teen who has surgery or a broken bone and takes an opioid as directed is very unlikely to become addicted. But taking more of the medicine or taking it for longer than prescribed increases your chances of becoming addicted. Sharing this medicine with others puts them at risk for addiction or overdose. Do not share your medicine with anyone. What happens when someone is addicted? Someone addicted to opioids will want to get more when the prescription runs out. This can lead to inappropriate or risky behavior, such as lying to a healthcare provider to get a new prescription, buying opioids from a friend, stealing opioids from friends or family, or buying and using street drugs, such as heroin. Why do we need to lock up the opioids? Sometimes people take opioids prescribed for someone else. For example, a teen might take a younger sibling's medicine, or someone might take a friend's opioid to manage pain, anxiety, or sleep problems. They might think that prescription opioid medicines are safer than street drugs because healthcare providers prescribe them. But prescription opioids can lead to severe side effects, dependence, addiction, and overdose. Keeping the opioids locked up will help make sure that only person they were prescribed for takes them. How do we safely dispose of unused medicine? As soon as you're done taking the medicine, your parent or caregiver should get rid of any unused medicine. Ask your healthcare provider or pharmacist how to get rid of extra medicine safely. They may recommend that you flush the medicine, mix it with coffee grounds, and then throw it away, or take it to a drug take-back program. The FDA has more information. Rohypnol. What it is. Rohypnol is sold in some countries as a sleeping pill, but is illegal in the United States. Because it can cause extreme drowsiness or blackouts, it is often used in date rapes. Sometimes called roofies, rooch, forget-me-pill, date rape drug, R2, rope, circles, wolfies. How it's used. This drug is swallowed, sometimes with alcohol or other drugs. Sometimes it's crushed and snorted, dissolved and injected, or sprinkled on marijuana, and smoked. What it does. Rohypnol has received a lot of attention because of its association with date rape. Many teen girls and women report having been raped after having rohypnol slipped into their drinks. The drug also causes anterograde amnesia. This means it's hard to remember what happened while on the drug. Because of this, it can be hard to give important details if a young woman wants to report the rape. Rohypnol can cause a drop in blood pressure, as well as cause memory loss, drowsiness, dizziness, and an upset stomach. Though it's part of the depressant family of drugs, it causes some people to be overly excited or aggressive. Users can become physically addicted to rohypnol, so it can cause extreme withdrawal symptoms when users stop. Salvia. What it is. Salvia is an herb that's native to the mountains of southern Mexico. One type, Salvia divinorum, has a substance called salvinorin A that can cause intense psychedelic experiences. Salvinorin A affects structures in the brain called opioid receptors. This makes salvia different from other hallucinogenic drugs like LSD and mushrooms, which affect the brain's levels of a chemical called serotonin. Sometimes called diviner's sage, magic mint, Maria pastora, Sally D, seer's sage, and shepherdess's herb. How it's used. As a drug, salvia usually comes as fresh green plant leaves or dried shredded green leaves. Salvia can also be a liquid extract. Traditionally, users chewed the fresh salvia leaves or drank the extract, but now people also smoke the dried leaves. What it does. Salvia's effects come on quickly, sometimes in less than a minute. They usually disappear about 30 minutes to an hour later. Salvia's effects on the mind can range from mild to intense. They may be frightening, depending on how strong a dose of the drug someone takes. Common short-term effects include hallucinations and changes in visual perception, uncontrolled laughter, mood and emotional swings, difficulty concentrating, a sense of detachment from self and reality, not being able to tell the difference between what's real and what's imagined, dizziness and lightheadedness, lack of coordination, slurred speech. Some studies suggest that, over time, salvia use may contribute to a condition called dysphoria that is characterized by feelings of depression, discontent, and restlessness. Smoking any substance over a long period of time, including salvia, can lead to breathing trouble and other health problems. The biggest problem with salvia is that it has such dramatic psychological effects. Because the drug can impair a user's coordination and reality so much, people under the influence of salvia can be a real danger to themselves. There is a substantial risk of injury or accidental death to salvia users. Salvia is illegal in a number of foreign countries, and in many American states. Possession or use of salvia in states where it is illegal is punishable by fines and jail time.